Okay, so I want to make a video on Lyme disease and ticks in children. So my little one here is 2 years old, and today was a normal day. It's December, but it was pretty warm out, so we were outside playing for maybe 30 minutes or so. Nothing out of the ordinary. We don't live in a rural area. We do live near some trees and stuff, but nothing crazy. So she was outside like she's been outside for so many other days. We don't have any pets. We don't have a real Christmas tree. But she has a tick. But basically we were outside this afternoon. We went out today, came home. She was exhausted. I went to go change her into her pajamas, and I seen this on her back.
No.
At first I thought it was like a black fuzzy, so I tried to get it off. It wouldn't come off. I looked closer, pretty much knew it was a tick. My initial instinct was to try to rip it off, but then I was like, no, let me call her pediatrician. Her pediatrician is a really good doctor. I was able to text a picture to him. Thank you. And he was like, yes, that's definitely a tick. And he said, don't try to take it off yourself because you could break it, leave part of it in the skin. He said also a tick analysis has to be done to make sure it doesn't carry Lyme disease, and you want to get that out properly, professionally, etc. So he recommended that we go to the local emergency room, and we are here now. We are not in we are in the emergency room, but they are so busy tonight. I guess for the less critical patients, they put them in office rooms. So we're in an office room right now. But yeah, so he said make sure they do a tick analysis on the tick, to go see him in the office tomorrow. I guess all doctors are different, but I'm glad that you know, we're here at the hospital, because how would I know if the tick had Lyme disease? I wouldn't know. Oh, I think I hear the doctor coming. Look how tired she is. I mean, she is so tired.
I'm happy.
Oh, you're happy? Well, I'm glad you're happy. I love you, sweetheart. I'm going to insert another video right now of the tick. It's a little bit clearer, and you can see it now. Okay, so the doctor came in and used a tick remover and got it off of her back. Let's see. Let me just make sure.
No.
Let me make sure it's gone.
No.
Let's see. Let's see real quick. Yep, just a red mark. Now they said that they do a preventative dose of antibiotics, but since she didn't have hers in for 24 hours, we didn't need to do it. But if I felt like comfortable with them doing it, do it. And I said, of course. So she's about to get a preventative dose of antibiotics. Also, her doctor said about doing a tick analysis, but they said that they don't do a tick analysis. They just give her the dose of antibiotics. And the way she described it is it kind of works like a flu shot. You give it to hopefully prevent Lyme disease if this tick infected have Lyme. Also, if it's not in for more than 24 hours, they said that even if it has Lyme disease, it may have not gotten into her. So either way, I'm like, just give the antibiotics. And they did. That's what they were going to do anyways, but of course I approved that. So as you can see, this tick is in a jar because her pediatrician said if they don't do a tick analysis, to get the tick and give it to him, because then he'll do a tick analysis. So that's why we have this disgusting little, oh, look at that. Oh, wow, look. Did it just move? Oh my gosh, look. It's moving. That was in my daughter's back. They said that when they get really, really big, that means they were on for a long time feeding the blood, basically. But since this one is pretty small, they said it sure it hasn't been on very long. Oh my gosh, this is the first time I'm seeing it move. Look at that. That little sucker was in my daughter. All right, so we are waiting for the course of antibiotics. We are going to be going to her doctor's tomorrow to give him this thing that's disgusting. It makes you scared to like send your child outside, but you can't live in a bubble. I'm gonna definitely have to start reading up on tick prevention. Also, I wanted to mention the doctor used this microscope to look to make sure all pieces of the tick were out. Obviously, you can't do that at home, so I'm glad we came. So this is what they had given us, basically talking about a tick bite, and this is what they gave her for preventative. And something else real quick I just wanted to say. Here, you can look at My Little Pony while I talk about this. I usually don't like to do a full inspection of my daughter from head to toe every day. And I usually give her a bath every day. Every once in a while, if we have like a long day and we're out, we'll come back and she will just be exhausted. I'll just kind of put her to bed, give her a bath the next day. And I almost just kept her in her clothes and just put her to bed. But like I was like, no, you know what, let me just at least get her in her pajamas. So I did that, and that's whenever I seen the tick, and I think, oh my gosh, if I wouldn't have did that, and if I would have just put her in bed, which I almost did, she would have had that tick in for over 24 hours. So I'm glad that I checked, and that's just like something else. It's almost like you just have to do an inspection from like head to toe of your baby toddler, because she's 2, she does communicate, but she's not going to say, Mom, I feel something funny on my back. I actually don't. When you have a tick, I don't even know how it feels. I don't know if she would have felt that on her back. I don't know if she would have felt it pinch her. I'm not really sure, especially she has sensory processing issues, so a lot of things don't really hurt her like maybe a normal kid. So I'm not even sure if she would have felt it, if a normal person feel. I don't know. That's just something else now every day. Like, I'm going to make sure I just like kind of look over, make sure she doesn't have any kind of tick. Like I said, it was on her back, like the top right part of her back, like right near her shoulder. That's where it was. So anyway, she is sleeping right now. The medicine that they had given her, she is one to not take medicine. So they tried to give it to her in a syringe, and she wouldn't take it. And I even said, she's not going to take that. And then the nurse was like, well, I'm a nurse and I have techniques. And then she got a smaller syringe. My daughter, she wouldn't even open her mouth. She is a strong little girl. She would not take it. She was spitting it out like nothing was getting in her anyway. So she mixed it with apple juice, and my daughter took like half of it. And right now as we speak, Mommy tried to put milk in it to try to get her to drink the rest of it. She probably should have taken it all at once, but she just wouldn't. So hopefully she is taking that all. Well, we have that much left, so I would say she probably got like 90% of it. I just would feel better if she drank every last drop. So Mommy's still gonna do her little techniques to try to get her to drink the rest of that, but we got to get ready to go to the doctor's here, so we will see you there. So we are at the doctor's waiting to see the doctor. But yeah, I think this thing is finally not moving anymore. When I first opened up the bag, I was like, oh my gosh, where is it? But it was just hiding. It's in there. It's gross. Yeah, the nurse even said it's crazy that they don't check for they don't check the tick. They basically, you're all better, yeah. And that they kind of just wait to see if you get symptoms. They said that's crazy. This office prefers to just check. So as you can see, my little one is out playing. I'm almost like, she got a tick probably for being outside before, but you can't keep them in a bubble. So she is playing, and basically what happened at the doctor's was they sent the tick out for analysis. If it comes back that she has, that the tick has Lyme disease, then, or whatever bacteria that creates Lyme disease in people, I'm not exactly sure, but she'll have to be on antibiotics for 28 days. If it does not have that, then she won't have to get any treatment. So that's what happened. Thank you for watching this video.